Have you ever heard of Crohn's disease? If not, today we will be breaking it down. It is a type of inflammatory bowel disease, or IBD, and it is characterized by the inflammation that occurs anywhere along the gastrointestinal tract, so from the mouth to the anus. The cause of Crohn's disease remains a mystery, making it hard to treat. Current medications have different effects and can't fully cure the disease. This is the biggest gap in Crohn's disease research. During remission, symptoms and inflammation remain under control, which is what physicians try to help patients achieve. Flare ups are times when the symptoms and inflammation are at their peak. The clinical symptoms include diarrhea, kidney stones, abdominal pain, fever, inflammation of skin or the eyes, and decreased weight and appetite. Certain individuals may be at higher risk of Crohn's disease. One of the main factors includes gut microbiota health. Your gut microbiota consists of bacteria and other microorganisms that live in your digestive system that help control and maintain digestive and immune system function and overall health. A healthy gut microbiota means that there's a balance of good and bad bacteria. Crohn's disease patients have a greater imbalance in their gut microbiota and have a decrease in microbial diversity. Other risk factors include smoking, bad hygiene, poor diet, stress, lack of sleep, and reduced physical activity. Crohn's disease can lead to many serious complications: bowel obstruction, fistulas, which is the formation of abnormal tunnels causing sores and ulcers, anal fissures, which is a tear in the lining of the anus tissue, ulcers, vitamin deficiency along with malnutrition, and colon cancer. Dr. Waliul Khan at McMaster did a study that investigated how serotonin disrupts autophagy, enhancing the probability that Crohn's disease will develop. Dr. Sabah Haq was involved in this lab under the supervision of Dr. Khan, and she got into touch with us to help explain the study. The gut hormone serotonin, which is also known as the happy hormone, regulates many normal functions of the brain, including mood, sleep, and appetite. Even though we know serotonin to be involved in brain function, in fact, 90% of it is made by hormone-producing cells in the gut called enterochromaffin cells located near the gut bacteria. These are very important in triggering IBD. Elevated levels of serotonin in the gut actually elevate gut inflammation, and reduced serotonin levels decrease the severity of inflammation. As stated by Dr. Hawk in the study, serotonin acts as a brake on cell autophagy, changing the gut microbiota composition, which leads to more severe disease. Autophagy is the routine self-eating and cleaning process of the cell. So too much of the happy hormone interferes with the cell cleaning process during gut inflammation. Further research needs to be done to determine the complete function and whether blocking the effect of serotonin on the cell cleaning process is unique to only certain types of immune cells or whether it is all immune cells. Since there's still no cure and many therapies have side effects, this project has future implications in understanding how serotonin aggravates IBD to create improved therapies. It is difficult to say whether IBD can be completely cured within the next decade, but recent data and research indicate that the IBD treatment should be patient-tailored and considered as a holistic approach that takes into account the role of genes, gut microbiota, and the immune system. As children, we reach for brightly colored treats like candies, soda, jello, and cereals. However, many of your favorite snacks have a red food coloring called Allura Red. And Dr. Khan, as a senior author on a paper that investigated the impact that Allura Red has on gut health and inflammation, the researchers found that long-term exposure of Allura Red disrupts the gut barrier by increasing the production of the happy hormone. And as discussed before, this increase in serotonin promotes inflammation and leads to the development of Crohn's disease, along with colitis. The manufacturing of snacks containing Allura Red has increased over the last decades, and its correlation with IBD needs more research. This video is for educational purposes only, and please contact your healthcare provider with any questions or concerns you may have.